Hi, this is Sam Collins, the coding and billing expert for HJRoss, and of course for the network. The network is something we've had for well over 25 years where we aid offices in making sure they're ultimately getting paid. We talk about it being compliance, but it's really about how it changes your office to not only be compliant, but to frankly make more money to make sure you're getting the deserved payments you are. So, many examples have come up over the years of offices that we've helped, and I just want to give you a few from the chiropractic end. When you're dealing with personal injury, often providers are often feeling cheated, not paid well, or feeling the victim of attorneys and settlements. We can help you do that. And I'll give an example. We had an office that the settlement was not what they intended it to be, or at least that's what the attorney's office told them. So they went through a whole scenario of saying, oh, doc, we got to cut your bill. What we did is to make sure they understood the protocol and algorithm that if you're going to make a reduction, there has to be certain things in place that happen. So this office wound up having much more money because instead of taking that $10,000 cut, which I know that sounds big, but that's what happens. You want to know what is the total settlement? How much is being paid to each provider? And we're going to make sure this is going to come out and be paid fairly and reduced according to each one. Because often what attorneys might do is reduce the fee to you, hoping that you'll take less and pay someone else more. I want to make sure that you're the one being paid. So in this example, we found out that the doctor's bill actually represented 60% of the claim. Therefore, at minimum, they should have 60% of the total amount of money set aside for the providers. So instantly, this went up from getting or being offered $2,000 to $8,000. So right there, that office made back its money over manyfold. And to this day, this is something I work with them often is to understand how do I make sure this claim works? Like when you have a PI claim, do you really know how to manage it? How do you evaluate whether it's good or bad, whether it's PIP, whether it's no fault, whether it's med pay? You have to make sure you understand what is my total bill, what is fair, what is reasonable, and be paid fairly by doing some work beforehand and knowing how to negotiate properly. What if the attorney's already taken the med pay? And this is a good example. If they've taken the med pay, we're much less likely to take any reduction without there being more information involved. And this comes up many, many times, not just with personal injury, but even in workers' comp, we've seen reductions where they don't understand the rules and guidelines where you're to be paid. What is the fee schedule? Often offices have problems where they have their fees that are all over the place. So a good example for chiropractic offices where I see probably about a 30-40% loss of income is not understanding the value of their fees. So one of the things we do with each office is go through your fee schedule based on your region, based on your state, of course, but meaning your county, and what are fair and reasonable fees. And we have to bring a lot of things into that. So, one of the things I do with an office is to make sure that, okay, if you're going to charge a cash rate, what is that going to be? And how do we compare that to your insurance rate? But as it in deference to personal injury. So, by example, we had an office that was charging the RVU for, or the relative value for a CMT code, was charging about 30% below of what they should have. So what it meant was they were billing a service at $50 that they honestly could get closer to about 75. So that was $25 a visit. Now, when you think of an office that's billing out personal injury, you're doing probably 3 visits per week. So that means $75 per week. So this office was able to make considerably more money because they just understood the value. If you're billing something at 50, but the value is 75, what are they going to pay you? Well, of course, they're going to pay you 50. But if you build 75, they would pay you much higher. So this is a common one where we often will get an office to make thousands more for every personal injury claim just by understanding their fee schedules. Like what is the relative value difference between a 98940 and a 41? Or that many don't even understand that exercise or massage actually has a slightly higher value than 98940. So in order to make sure your fee schedule is fair to you, you better make sure and understand what your fees are and not be victim to, oh, I thought that's what I could do because what my friend has done. And this really comes up even when it deals with Medicare. Many times offices don't even understand the Medicare values and how Medicare works. Medicare is not necessarily the highest payer, but I had an office that figured out and said, well, Sam, I'm thinking I want to start doing Medicare because all of a sudden my population is changing. You realize baby boomers are coming of Medicare age, and all of a sudden they had so many more patients. They had to figure out, well, what am I going to do here? I don't want to see them. Well, of course, for Medicare, you have to be an enrolled provider. So what we did is we enrolled them as a non-par provider. That allowed them to charge the limiting charge. And let's break down the money. I know everyone thinks, well, Medicare doesn't pay very much, but assuming you're billing out a 98941 on average, this office was getting about $45 per visit for that 98941. Now, the average number of Medicare patients that are typically, or the amount of visits a Medicare patient can have, is about 20 to 30 per year. So I'm going to keep it on the low end and say you're going to see them only 20 times. Well, that's $900 of reimbursement just for Medicare, not from the other services that aren't covered. So when he started doing the math, he realized, he goes, well, I'm seeing about 50 Medicare patients per month. So let's say if you're seeing 50 per month and you're looking at 20 visits just on those patients, all of a sudden those numbers add up. I mean, if you have 500 Medicare patients in a year, that is roughly about $400,000 of income, just doing the math of, well, if it's 20 to 25 visits. So understanding how that works, though, here's the fear. Offices without the network help don't understand how Medicare works. How do I join? Should I be par or non-par? What's my benefit? How do I make sure if I'm running a cash practice, can I make this work? And you can. But without that knowledge, this office was missing all these patients. So this example, in this same office, when they joined, one of the things they noted, they said, wow, Sam, we made all these differences to our fee schedule. We started changing the protocols with even Medicare. And he goes, we're seeing about $8,000 to $10,000 a month of extra income. And he goes, thank you for that. He goes, but he's also very upset because he's been in practice about 10 years and he realizes for those 10 years, he wasn't doing any of that. And so often offices don't have to do anything to increase patient numbers, but by understanding the values of the type of services you're doing. Like, by example, do you have to take every insurance that's out there? Is it worth it? And that's one of the things we help you do with the network, is to understand in your area, what is a good or a bad insurance? Whether or not is it useful to join? Whether or not there's enough benefit. Many times offices join insurances assuming that's going to benefit their office when it takes it away. So here's an example of an office. Before they joined, they decided to join and be part of United Healthcare. Well, that's fine. You can certainly do that. But then they realized, they said, well, Sam, I was getting about $120 per visit from United Healthcare. Once I joined, that was cut in half. I'm getting $60. So I had to have them understand, well, wait a minute, before you join, did you understand that? Because for many offices, when you join United Healthcare, you, of course, have to join Optum Health. And in doing so, they pay a per diem payment. Per diem means they pay one fee no matter what you do. When you're out of network, then there's the decision of, oh, it pays fee for service. So one of the things we have to do with every office is to make sure when you join something, what are the pluses and minuses? And what this office figured out, they wound up dropping out and it increased their revenue. The same would apply with, for instance, for many of you for Cigna. But there's things to weigh in. How many patients come to you because you are enrolled, or do they come otherwise? So it's very careful that you have to be before you run into joining these things, know that whether it's good or bad. And that's where our expertise comes in. We literally speak to hundreds of offices a month. So when there's a trend or something changing, we are aware of it right away and can make sure all of our offices are making sure they're up to date. So by example, diagnosis codes update every October. So I recently had an office that was billing out going, Sam, all my claims are being denied. Well, it's because they weren't aware of the updates. They weren't a member at that time. And I said, well, we'd love to have you. They said, well, I don't know if I want to join. Of course, the membership gives you seminars, the one-on-one with me. But what this allowed us to do, I said, when you join, we can immediately get into what these code changes have updated. And what they weren't aware of is that there were major changes when it came to back pain. Now, you're going to think, well, that changed 2 years ago. I know it did. But if you're not aware of it, often you're going to wind up being denied. So it's a way to make sure you're always up to date. What codes are you paid for? Here's a good example of an office that was getting really hammered by Aetna insurance. They were going, Sam, I'm having trouble being paid by Aetna. What we were able to teach them with the network is that Aetna has a very specific code list of codes they cover or don't cover. So as a network member, I was able to give them, here is the list for Aetna. Verify before you bill anything to Aetna. Verify the code that you have on the claim is a code they allow. And so what was happening for this office, they were billing out sometimes 3, 4, 5 codes a visit, which is fine. But I said, you do realize even if you're billing 5 codes, but one of those codes are non-covered, it's going to deny the whole claim. So what we were able to do is to make sure we knew that he had certain codes that were trigger codes. Don't use those. And often it's something as simple as that. And we see the same thing with Medicare. Are you aware of what codes Medicare does or does not cover? Every state can be a little bit different, though it's regional. Will your state accept M9901 through 05? Or do they accept M9900 through M9915, all of those codes. And what are the secondary codes that they cover? Do they cover sprained strains? Do they cover radiculopathy? Do they cover all types of musculoskeletal? For the most part, yes, but the network allows us to make sure you have that list. So, by example, one of the problems we run into for offices are often being denied from Medicare for simple things. And as you can tell, it always comes back to a money issue. They're going, Sam, I'm getting denied with a CO16. It says my claim is missing information. Well, we take a look at that claim and we notice there's certainly three things that commonly are missing, whether you don't understand how to use block 11, 14, or the proper diagnosis. So generally, we're able to correct that, and it's an automatic increase in revenue because you're not dealing with this rebilling and constant frustration. Think of how many times an office says, oh, I don't want to do Medicare because I heard they're bad. They're not going to pay well. Well, Medicare pays better than most of the HMO PPOs you join, and it's a guaranteed group. You just have to understand the nuance. And that's what we do. Do you know what codes are covered? Too often we guess and we think, well, that's what my friend did. Well, we don't know what your friend is doing is a good thing. Remember, if you ever told your mom, well, Johnny did it, would your mom ever accept that? Well, we don't care what Johnny does. I want to make sure my offices know what is required so that you're getting paid. You do great work. You're helping people, but do you really understand what does or does not get paid? Do you have that list for your state, for your region, for the type of coverage you have? Cigna has its own list as well. And this comes up often too when offices run into problems, and it's not just about payment. Obviously, everyone hates the word audit because you're afraid, oh my God, I'm going to get in trouble. What we have found is if the more we're compliant, the less you're going to be audited because your claims go out properly. Like, have you ever had your office evaluated for the amount of services you're providing and types of services? There's a ratio of CMT codes that if you fall outside that ratio, you could be more vulnerable to an audit. What about certain types of therapy codes, volume of therapy codes? Which ones trigger more looking at the claim? We want to make sure you're ahead of that. So an example of an office we had, they received a letter that said, your office is billing more services than you could possibly do in a day. Because they said you're billing out 24 hours of services in one day. Now, that may seem like a lot, and I'm not saying it isn't, but let's keep in mind when I looked at it, I said, well, hold on, if you're a single provider, that could be a little bit difficult, but obviously are in some states, can you have assistants do therapies? So you might be adjusting 4, 5, 6 people per hour, but have multiple therapists that do that. So one of the things we do is to go through the files to make sure, is everything compliant? Do you understand your state's requirement? Do you have to be on site when these therapies are happening, or can it be the 50% rule that you have to just be prescribing and be available by phone? That does vary state to state. Too often offices are guessing and lose the compliance that way. So we make sure to go through and say, well, if you're billing out these hours of services, who's providing them? Is the time documented? Probably the number one area chiropractors run into trouble is understanding the value of time when it comes to therapy codes. And if you understand the 8-minute rule and how much can be done and how many units, how do we combine multiple services? That's something to be mindful of. So an example, though, of this office, though, they received a letter, and that, I'm not exaggerating, they literally wanted back $290,000 from them because they said it was improper. So we said, well, slow down. Before you panic, let's take a look. We went through all of their files and everything was documented. There were some areas that probably could have been a little better, but they were still evident. We were able to push back on that. Wound up, there was no refund because it was all there. One of the things that triggered it, though, was the volume of 98941s that they were seeing. Are you aware of that percentage? So I went to the office and said, okay, well, how often are you billing a 98941? They didn't understand. They weren't sure how much they were billing 98941. I said, well, that's something we go through. It's one of the things with the network we want to do is look at what are the percentage of patients that you're billing a 98941. Because in doing so, what we're able to look at is to see, are you above the norm? Now, generally, that's considered to be about 55, 60, 65%. But what if your office is billing out 80%? Does that make it wrong? Well, one of the things we do with the network is to audit files. So I had an office, we audited because his numbers literally were close to 90% of 4-1s. But then when you went through his files, you realize he dealt with a very referred practice, if you will, or a lot of referrals, but also a very sports medicine practice where there was extra spinal, but multiple spine areas from the type of injuries. So for his practice, it made sense. So therefore, we're able to push back and go, no, it was all documented. The thing to be careful of is understanding, how do I properly choose a 98941? Are you choosing it based on your technique? Or are you doing it based on not just technique, regions manipulated plus diagnosis? That's what we have to go through. And then, of course, look at the amounts. I will certainly say I'm not against you billing what you feel is necessary or what's documented, but we have to make sure, was it documented properly? So by example, an office we had, and this is one that we made him quite a bit because he was getting disputed on his use of E&M codes. And as you're likely aware, evaluation management codes can be based on medical decision making or severity or the amount of time. So he was billing out 99204s quite a bit and 14s. And so the insurance company on one particular case came back and said, your billing of 99214 is not adequate. So his response back was, it was. And he said, in fact, because he spent 25 minutes. And of course, the insurance company, based on that statement, denied it. So then he came to us and said, well, Sam, this is frustrating. So he joined. For him, the value was there because immediately I said, well, let's take a look. He was billing out a 99214 and 25 minutes is not adequate if you're using time. But time is not the only reason to choose an E&M code. So what we went through is his file and said, well, let's look at this, because in this particular case, this was a patient involved in an auto accident. The accident was a year and a half ago, though. And so this was a re-exam of this patient. Well, if you think of it, a patient that had an injury a year and a half ago compared to now, we would all obviously state that's a chronic condition, and I would say complicated. Based on severity, that means it fits for a 99214. So all that statement of not wanting to pay for it, it increased his revenue $100 for each time because we were able to dispute it wasn't based on time, but the medical decision making or the severity of it. Another office that we had, and this is one that's common because a lot of people think, well, I joined the network, it's all about insurance. And it's not. Certainly, we help you with insurance coding and billing and what's good or bad. But one of the things to keep in mind, chiropractic has always thrived on a vibrant cash practice. And what we do with the network is to make sure in doing that, how am I doing it legally? Because example, most people want to know, can I give a cash discount? What is legal in your state? What can you allow? That varies from state to state a bit, but I'll give an example. In California, we had an office that he was being pushed back from an auto company that was saying, well, we noticed that your fee for a cash visit is $50. Yet you're charging us over 150 per visit for this PI case. We want to only pay you 50. Well, how we're able to protect him, because we did this before, his cash visit, he was allowed to have a $50 fee because it's a much different service. They would come in and receive manipulation only, and it was 50. However, because it was personal injury, what we pointed out is, well, this patient not only received manipulation, but due to the severity of injury, many more services to deal with the acute nature of the problem. So they were receiving 3 to 4 services per visit. So was it reasonable in that way? So one of the things we make sure for each office, are you doing the right things when it comes to a financial agreement? Where we saved this office was the patient had a clear financial agreement with the No Surprise Act added that showed what the fees were and the amounts. And that actually the amount for the cash discount wasn't a great amount. It's just the amount for a single service. Often when you think of cash visits, what are we really doing? It's a simple treatment. It's probably just an adjustment. Therefore, it's going to be cheaper. So have you set yourself up to be protected, to understand, how do I make sure this works should someone question it? And what amount can I give? How do I make it happen? How do I make it compliant? By example, if you're offering a cash discount in most states except California and Minnesota, you cannot offer a substantial cash discount, but just 5 to 15%. Is there any way to deal with that? One of the things we do a lot is to help offices understand prepay plans. These are allowed in every state. Some have different nuances state to state, so we'd have to know specific to you. But however, what's allowed to happen is pretty much what you see happening at the joint. And I would say, why wouldn't I continue that? So I'll help offices often start to work on that, realizing, let's say you start doing prepay plans. You do it in a way that is conducive for your patients to afford, understand the value. But let's say your prepay plan is only $500 and maybe it's for 10 visits or 15 or whatever. But you begin to set up where you're selling 10, 15, or 20 of those a month. Think of the revenue difference of $5,000 to $10,000 by offering someone a way to afford your care. One of the biggest problems, I think, for people getting healthcare, and I've seen this over and over with doing the services that we provide, is making sure that people understand the value. A pain point for every patient is going to be money. Have you ever really done anything to look at money? Have you really had any expert that goes, what is the fee schedule? What is allowed? If I offer a prepaid plan, is there a limit? Do I have to put money in a trust account? These are all the things that you can do, but we have to make sure you're doing it compliantly. Your state may have slightly different rules, so don't guess and assume what your friend was doing was good. We want to make sure you know. So here's an example of that office I mentioned that joined that HMO. And one of the things we do, and when I say HMO, is joining when they join United Healthcare. When you join something, have you ever went through about whether it's a good or bad thing to join? So I'll give an example. I know you're all familiar with American Specialty Health, or ASH. I don't think they're necessarily a bad company. I wish they paid a little more. We'll talk more about that. But bottom line is they pay what they pay. And you have to look and understand, is it enough value? Is this patient otherwise going to come into me and pay cash? So what we went through in office was all the pluses and minuses. And turned out there were slightly more minuses to it. So they decided not to join, but they were afraid, well, wait a minute, what about the people that otherwise have no benefits? So what you're able to do is, have you ever thought of, do I have to join everything? By example, did you look through, and this is what I'll help you deal with. When I join, do I have to join everything? By example, ASH does allow you to opt out of certain parts of their plans. You can join the PPOs without the HMOs, or vice versa. So here's an office, we had an example of that decided they were going to drop all the PPOs. To me, that made sense because this was a plan that would already pay you. So why would I do it if I can get paid out of network even a little bit more? But what they did decide was to stay in the HMOs. Now, they will tell you that the HMOs still didn't pay very much, but they said, Sam, I'm getting about 10 new patients a week under this. And though it's not much, the revenue per month was about $3,000. But the bigger picture they found out is they said, you know what we realized, Sam? By seeing these patients, it built our practice because they realized that those patients, while they came in themselves, they referred others. And remember, a referral of one doesn't mean they're only going to come from that plan. They know other people. What if they have a personal injury? So it's opening the doors. One of the things I think often that offices don't understand, particularly when you're starting, is you got to start to work to try to open yourself up to touch as many spines as possible. If you're not, then how are people going to know what you do? So one of the things we help you with is, where do your patients come from? What are the 3 ways of cash? What are the 9 type of insurances? Are they good or bad? And generally what you're going to find, there are going to be certain things you accept. I think the bottom line in the practice is you are still running a business. Now you have to be a really good provider. That's number one. That's what we always want. Help your patients, but you still have to run the business end. And so we have to be careful that we have to understand, is there enough value? Do I make this work? Do I want a practice that's going to be the 99-cent store of chiropractic? There's a value and a place for that, but is that for everyone? Think of it this way. Have you ever really evaluated the types of patients you see? So one of the things we do with Network is to make sure we have one-on-one Zoom meetings where we meet face-to-face. We talk about your practice, your region, who you're seeing. By example, if you have someone that works at Costco, could that be a really good patient? Certainly. But what if they work at Walmart? Their insurance is not very good. So going through all those nuances. But the biggest factor is always just about the revenue. Do you understand the value of services? Do you understand the basic documentation? Have you had anyone ever audit it? Because people always think, oh, okay, audits, I'm afraid. I want our offices to never be afraid. One of the things I'll do with you is to audit your files. No, not everyone, but we're going to take a sample. Because here's what I've learned in all these years. When we catch problems, we fix them. And when you fix them, you show that you've done it. So here's an office that honestly was poorly documented. They joined the network. We caught it and said, hey, let's make these changes. A few months later, they received an audit for some old claims. Those old claims weren't very good. And at first they were thinking, oh my God, these are going to be a problem. What we were able to do is to demonstrate, actually, we caught those errors ourselves and we made changes to it. And we even noted the date. The insurance company wound up not recouping any of it because the office self-corrected. It's not always as punitive as you think. It's more about, is it compliant? And I think for compliance, you always want to think of, what is really the network there to do? Create compliance. By creating compliance, we're going to increase the ability to send claims out properly. When you send them out properly, you're paid, and proper claims, frankly, get less audits. And that's what we're looking for. You don't want to create headaches. So, in other words, you're going to cherry pick a little bit. Have you ever thought of what is a good insurance and a bad insurance? And one of the things I do with the offices is to go through what are the plans you're seeing? How much are they paying? Have we created an algorithm for that? And that comes to when people think, well, I have to do pre authorization. So here's a good one I've had. And this happens with many carriers because you're probably noticing it now that United Healthcare, at least for their Medicare ones, are requesting, and ASH and similar always have. And they do this pre-treatment authorization. One thing you have to know is what things is an insurance company looking for when it comes to these audits? You know what the end of the day is? Did the patient get better? I will tell you, one of the best things we do with the network is to make sure you understand that algorithm. How do I demonstrate chiropractic care? It's not about saying the patient feels a little better. We go through a form and a format, if you will, of factors you have to hit. We talk about the pain level, but not just pain, their function. When their pain level's an 8, what can't they do? Now that it's a 5, which is better, what can they do better? Because we know there's a lot of nuance in there, which means, are you using the most up-to-date outcome assessment forms? As a network member, you will have access to over 50 for various things from insomnia to shoulder pain, of course, back pain, neck pain, headaches, and so on. But you also want to use one that's simple enough for a patient to understand and use properly and know how to grade it. Chiropractic care works really well, but I always ask, do your notes demonstrate it? If you really look at it objectively, when you see it, does it look objectively better? Or are you using a lot of statements like, my patient feels better, which is not a bad thing, or the tenderness is less, but without objectification, going to be a problem. So we go through a protocol to make sure you hit each one of those points and do it with you and staff, because a lot of times staff is doing therapies or documenting. We want to make sure that's all there. Bottom line is, do you understand what makes your practice thrive? Have you started to realize the business end? In a way, what I would put the network is, we're a chance for you to bring your practice onto the show Shark Tank. Have you really looked at, how is my practice doing? Have I looked at parameters of what's good or bad? And often you're so focused on patient care, you lose sight of that. So we're able to circle back on that. So by example, when codes update, where do you get them from? Are you trusting that eventually you're going to see them on the internet, or do you get them from us first? When fee schedules update first of the year, are you aware of it because you eventually get it, or do you have a place that sends it to you? As a network member, before the end of the year, or right at the first of the year, depending on when they're published, we make sure you have all your most current fee schedules and how to use them to your advantage to make sure, do I value it properly? By example, how many of you have created a protocol that every first of the year you look at your fee schedules and make some adjustments? You often complain, well, no one's paying me more. Do you ever charge more? Do you ever understand the value? Now, realize certain HMOs you join are going to be problematic, but bottom line is, if you are billing 50 and they're willing to pay 75, how much are you getting? Lastly, I'll point out that often chiropractic offices don't understand the value of services, but also the value of adjunctive services. The good news is chiropractic manipulation fits through the entire course of care, acute, chronic, and so forth. However, what about therapies? Have you ever thought of, what are the therapy best practices? Am I focusing on active care? One of the biggest areas I help offices to understand is the focus on active care is not only better for your patients and their outcomes, it also pays better and you have less pushback. Think of how married many offices are to passive care, massage, manual therapy, which have their place, but also difficulty being paid. Whereas if you ever had issues with exercise, therapeutic activities, or what is the differences? Like, think of it, you've seen all these codes and you read the definition, it says therapeutic activities compared to exercise. Do you know the difference? There's not a network member that does it and understand the nuance of why. Or what is neuromuscular education? And I often get this one with Sam, I have a vibration plate. What can I bill that as? Well, do you really know? Be careful. It's not what the people who sell it to you tell you necessarily. What about, can I be paid for laser or shock wave? What is the code? We're the resource for that to make sure that you're always getting paid. Think of it, network is a chance to have a coding and billing expert. I'm a person that the Department of Justice reaches out to. State departments of insurance do as well. Medicare. I'm even part of the World Health Organization and actually on the board of United Healthcare Optum Health. It's a chance for us to make sure that you have all the correct information, not hyperbole, not exaggeration, not old information, but the most current. That you, your staff, or whomever you designate can call me. You can send me an email. We can set up a Zoom. How cool is that to have a staff person for the price that we charge? And it includes in continuing education. How often do you find that you have all these questions and you're guessing at, well, let me see this or try that? Don't guess. Let's know what's covered. The HJRoss network is that for you. And that's the service I want to be. I love this profession. I'm a chiropractor. My dad was a chiropractor. This is what I do. In many ways, I want you to realize as a network member, you're my patient. I want to make you better. And that better is the compliance. But ultimately, and it's not to overly delve on it, it's revenue. You are a business. We have to make sure you have the best revenue. Do you have sources for you to do that? HJRoss Network is just that.